Without further ado, I would like to introduce Dr. Samuel L. Bradley Jr., who joined the Boston College School of Social Work as an assistant professor of macro practice, focused on equity, justice, and inclusion. He is an accomplished musician, community activist, and administrator with extensive experience in fundraising and communications. Dr. Bradley has expertise in diversity and inclusion, public health, and program innovation. He's particularly passionate about utilizing design thinking as a strategy for developing innovative higher education, as well as leveraging higher education programs to support community outcomes in marginalized communities. Dr. Bradley brings over a decade of organizing experience across the country. He will lead a no-holds-barred conversation with us on what white supremacy is, how it shows up in the workplace, and how a health equity framework can begin the process of working towards undoing systemic racism. Dr. Bradley will outline his own personal successes and failures in an accessible talk about how to strive towards equity and justice in the modern world. We will be given a chance to discuss best practices for organizing for health equity, not only for our patients, but also for fellow practitioners. For the next 15 minutes or so, Sam will be sharing how to spark conversations about systemic racism and ways that we can take action now towards creating a more equitable and human-centered future in our individual lives and communities. All right, Dr. Bradley, all you.
Thank you, Katie. Appreciate it. Good evening, everyone. I'm going to share my screen. All right, so a white supremacy explainer. Before we get started, please resist the urge to clutch your pearls or to get too excited. I promise this is going to be something that I think we're going to benefit as a community in terms of having the conversation. I just happen to know that the term white supremacy usually makes us all feel a little bit nervous. So I just want to say it beforehand, buckle in, take a deep breath. It's going to work itself out. So big shout out to Melody, Katie, Paul, Rhea, Andrea, and Rachel for being the organizing team to get us through this. I'm really appreciative of all the work that they've done in the background. I also want to give an even bigger shout out to Lachlan Faro. He's been a wonderful friend. I just moved to Boston College, to Boston in general, just about 11 months ago. And we connected almost right away. And it's been wonderful just to have our conversations and to share and to get to know each other. I also want to give a shout out to Chelsea LaRuth, who might not be with us. So, I don't know if folks are aware, but there's a hurricane expected in the Gulf Coast region that is going to be sliding in tonight. And so my prayers and thoughts are with the New Orleans chapter and even the folks in Birmingham. That's where I actually did my Schweitzer Fellowship, was in New Orleans. So just a little bit about me. I'm originally from Mobile, Alabama. If you don't know it, look it up. It's a wonderful place. Go visit. It's home of the first Mardi Gras in North America, which is a little tidbit that people from New Orleans hate when I bring up, every time. So I just keep doing it. So then after I finished high school, I decided to go to college in New Orleans, where I studied music classically and then studied social work, which is how I ended up becoming an assistant professor of practice at Boston College. Also, while I was in New Orleans during that period of time, I worked with an organization called the Forum for Equality, where we did work around organizing to disrupt workplace discrimination against LGBT folks. So you might not know that historically in many states, it was actually legal to fire someone for being gay, queer, or trans. So you could get married on a Friday and fired on a Monday, and it was perfectly legal. So way back in 2016, we started to work. We had located a potential politician who could become governor of Louisiana. His name is John Bel Edwards. We loved him. We interviewed him. We worked with a coalition because there's no organizing that happens in a bubble. So we worked with several different statewide. The host muted me. All right, let's see. Can you hear me? Okay, all right, going back. And so because we don't work in a bubble, we do organizing across a vast array of constituencies. We were actually able to work together to get John Bel Edwards elected, and very thankful to the folks of Louisiana, all the organizers, and then shortly thereafter, he followed through on a promise that he had. The promise was that he would work to actually put a prohibition on the firing of LGBT state employees, which he successfully did. At that same time, there was a what we call a bad bill in North Carolina, a bill that was actually discriminatory towards trans folks who wanted to just use the bathroom that correlated with their gender identity. And so as a result, the NBA actually pulled its all-star game out of North Carolina and moved it to New Orleans because John Bel Edwards had made this declaration in support of eliminating discrimination. Shortly thereafter, Attorney General Landrieu actually sued the governor. And we were watching this all sort of go back and forth. If you think like a tennis court and you're kind of, your head's like moving back and forth like this was the experience that we were having of the ups and downs of, finally locating politicians who were able to work with us, getting the policy out there that we were hoping to get, and then finally having it slapped down after we got sued. The Attorney General was successful in his lawsuit with the Louisiana Supreme Court. So many of you who are kind of familiar with the plight of employment discrimination work are very aware that SCOTUS, the Supreme Court of the United States, recently ruled that it is now illegal to discriminate against someone due to their sexuality, gender expression, or gender identity. I tell this story and I feel really hopeful when I think about it, even though I may not have always felt hopeful in the moment. And I feel hopeful because, we put our nose to the grindstone. We kept working for years and years on this project. And I came in like 6 years ago working on that project. And there are people who have been working for decades as organizers in that area. And so that's my way of saying, like, don't give up hope. It's an essential quality to the work that we do. All right. So when I showed up to Boston College, probably the number one thing that people asked me was, I just want to be able to have conversations about race and racism and like to navigate these difficult conversations. And I'm not sure how to do that. Fair. A lot of us didn't receive a lot of education in this area. And so I have a set of community agreements I'll ask us to think about. And I'm going to send this PowerPoint over to Rhea and Melody and Katie, and hopefully folks who might be interested in it can take a look at it. It's got a couple of neat citations and some readings that I think you might find interesting. But this particular part is actually my favorite part, the community agreements, because it is a framework for the way that we can engage in conversations with each other that are oftentimes difficult to have. So the first one is to respect the boundaries of each session. When I say session, I mean this time period that we have together. I will watch the time. I promise my best not to try to bore you or to take too much of your time up. But also when you hear stories that people share, take those things as almost one-on-one, engagements, and don't feel the need to go then share that information with people outside. Use that information introspectively to learn and grow from it. I ask you all to engage in active listening. That means listening without sort of the intention of responding. It just means listening to process and to understand. Pay attention to feelings of defensiveness. Oftentimes that shows up very physically for a lot of us. We feel hot and flushed. We're flustered. We oftentimes stop listening. When you feel those feelings of defensiveness, I ask you to practice self-reflection. So like pay attention to your body, pay attention to your breathing. How are you feeling? All of those things are indicative of these conversations, by the way, that we almost never have in our daily lives. So we talk about racism, and then we feel suddenly defensive because it's like, are we talking about ourselves? Yes. Racism is identity work. And if you can take anything away from this talk, it would be that. Racism is identity work. And anti-racism is identity work. It is the nature of exploring who you are and your social context in the communities that you work in. I will practice wait, which is why am I talking? I'm talking currently because I'm the lecturer, but I ask you to consider, why are you talking, to give other people space to think about how they would like to respond to it. If you're like me, sometimes you're a little bit more slow to respond. So we just want to give everyone a chance to kind of speak in their groups. So trust the process. I wouldn't be a social worker if I didn't say this, which just means opening yourself up to unexpected things that might happen this evening, and to expect and accept non-closure, which means that in 15 minutes, we're not going to solve the world's problems. Although for Schweitzer Fellows, we might get pretty darn close. And then finally, I ask you to commit to doing reading and any work necessary to grow from this experience. So what is white supremacy? I am currently in love with Sister Crystal Marie Fleming. She just made full professor at Stony Brook. She says, first, white supremacy is most fundamentally a system of power designed to channel material resources to people socially defined as white. Second, white supremacy is not just neo-Nazis and white nationalism. It's also the way our society has come to be structured, such that political, economic, and other forms of capital are predominantly maintained by elite whites. Finally, white supremacy is inextricably linked to other systems of domination. I love this quote. If you get a chance, definitely grab her book, How to Be Less Stupid About Race. It's definitely provocative and very thoughtful, and I think it's one of the best books that's out there right now. One of the things that I think is really important to point out from this particular quote is white supremacy is not just neo-Nazis and white nationalism, which is the way that we oftentimes frame who is a white supremacist and who is a racist. It has to be somebody with a bed sheet over their head burning a cross in the front line. No, that's actually not how we got started. We got started in this country with an elite group of white men who created race and racism at exactly the same time. That justification was needed in order to justify chattel slavery. And so we've continued to then create more separations through the law and other forms of power, such as education and healthcare, to separate groups, one that is white and one that is something else. So then how does white supremacy show up? So this is a really great link that I highly recommend. It's also in the PowerPoint to go take a look. I won't go through all of these since we're short on time, but it shows up in a bunch of ways. And I just want you to take a look at these and see them as sort of one word, domination, which is control over other people. You know, so when you assert a sense of perfectionism, but then you don't praise people for their work, you are unappreciative of what they've done. When they make mistakes, you put them sort of like on blast in front of everybody else. You create a sense of urgency, mostly needed to what your outputs are, what your money needs to do for you. And it also shows up through power hoarding. So that means where power is normally placed at. In other words, who makes decisions? Where do they make decisions? Who has access? I'm currently working with a very large progressive voter registration organization in America right now, as I do a lot of consulting and coaching around this area. One of the things that they talk about is, you know, that they have what's called a table, which is where they do their political organizing with smaller groups that are state-based to get out the vote, and how they assert power in order to get that done through saying like, hey, like if you don't meet our deadlines, do the things that we want to, particularly for communities of color, we're going to take the money away from you that we've been giving. That's been a lifeline to keep your organizing afloat. That's the use of power, and that's how it shows up. So what does anti-racism actually look like in this context? You know, just probably like 15, 20 years ago, if I had asked that question and then separated these two slides by race to look at what anti-racism looks like for white folks and then what it looks like for BIPOC folks, BIPOC meaning Black, Indigenous, people of color, people might have actually chased me out of the audience. Luckily, we're virtual, so you can't chase me out of anywhere, but I'm going to separate this into two different slides, one for my white audience members and the other one for my BIPOC community members. For my white folks, I'm asking you to commit daily and even hourly acts of anti-racist resistance. So, one of the kind of like infamous things that happens is you're in a conference room somewhere and someone says something horribly offensive, aimed at BIPOC folks, Black, Indigenous, people of color, and then the scene ends, and your Black coworker walks into their office and they sit down, and then five white coworkers come running to their office to say, "Are you okay?" And I always, everyone's different. Black folks certainly aren't monolithic. I hate that though. I hate it because my thing is always like, why didn't you say something in the conference room when that racist act was taking place, that racial abuse that was happening? Why was it my problem alone to deal with? And then you came and you wanted me to kind of perform, not feeling okay, and to validate your feelings of, oh, that person's just terrible, but you didn't step in. So when you think about white allyship, you think of it as a card that's spent at the end of the day, and you have to renew it each day. I would, in fact, never even claim allyship. I would work towards that. I would commit myself as a lifelong journey to work towards that. And then finally, I asked for my White Spicer Fellows to consider not leaning on Black people to educate you. You are some of the most educated people I will probably get to talk to. In fact, I think in the last several months, this probably is the most educated crowd and most diverse in terms of discipline. You know how to do research. You understand how policy works. This is your opportunity to dig in and to really explore. But don't, while you're doing that, you're going to read several books. I'm sure many of you are going to read several articles. I'm going to ask you to do a little bit more in a second, and I'll explain. So working while Black. So this is to my BIPOC folks. I really encourage you to gather key support early. If you're looking at making any kind of social change in your organization, don't go it alone. Really build a cadre of leaders around you. When you are tired, don't feel compelled that you have to educate white people. Let them do the work, encourage them to do the work. Invest in yourself. So that means investing in your own healing and your own survival, whatever you need to do to make that work. So that could be exercise. That can be, actually quitting a job if it's not working for you. And then finally, I don't like to show up to traffic in false hope, because oftentimes in these situations, a sense of hopelessness can be quite common. But I encourage you to know that you have the power to make significant change when you work with communities and groups. And so I encourage you to continue to do that hard work, or secure the bag, as my students would say. So how do we get started? So this process actually is one that I would recommend for all of our audience members tonight, which is self-exploration, discovery, and emotional intelligence. We oftentimes, I have to tell you, so I've kind of undergone my own kind of transformation, because probably I would say 6 weeks ago, if you had spoken to me, I would lead first with policy, which is typically, where my brain is and sort of like my academic training. But I have come to believe that the journey really starts within all of us. So listen, absolutely policy, absolutely voting, absolutely paying attention to the statistics around how we're doing with both our patient access as well as the coworkers that we work with in the workplace. But also at a certain point, once we get past intellectualizing the harm that we've done over decades and years related to white supremacy, is the part of us that has to engage in some self-exploration about who we are, our own history, and our own identity. So that means doing things like exploring art, media, and artifacts of your own familial history, really coming into contact with who you are on a historical basis. And then taking time out to really understand the history of BIPOC folks in this country. There's some really great books out there. One that I am currently reading is How the South Won the Civil War by Heather Cox Richardson, which is really great. Again, Crystal Marie Fleming's How to Be Less Racist. You guys know these books already. Robin DiAngelo, Ibram Kendi, they're all great out there. And then finally, emotional intelligence, which is really a hard one, I think, because many of us are trained to never admit our own faults. So I just want to encourage you now to acknowledge when you're wrong. In fact, it's preferable to never acknowledging it. And it helps to deconstruct the systems of white paternalism that we are oftentimes stuck with when we just say, I'm sorry, I made a mistake. And then to understand that your lived experiences may be different from others. I'm going to stop sharing there and open it up for questions. Again, this slideshow I'm going to send around. It's got a couple of reading opportunities that I think some of you might find interesting. All right, I'll hand it back with that.
All right, fantastic. Thank you so much, Dr. Bradley, for your talk. We're going to go ahead and open it up to questions now. I've got a couple in the chat, but please feel free to send me more as we go along. The first is about community organizing, and we would like to ask Dr. Bradley, how can we get involved in community organizing? It's obviously something you've done quite a bit of very successfully, but what are steps that people in this group could take right away to get involved in that space?
Absolutely. So it just depends on where you want to start your organizing from. If you're already maybe donating to an organization, that would be a good way to reach out to maybe the person that you get the thank you letter from, and to say, hey, look, I'm really interested in getting involved. Oftentimes when we start the process of our first opportunities to do some community organizing, we find ourselves getting a little bit flustered and frustrated. Don't become discouraged. It's the first thing that they ask you to do with your MD is to sit at the registration desk and check off names for people who come in to events, right? Like we all provide something to community organizing, and oftentimes, you know, when you're first getting involved, people may give you smaller tasks to complete before they ask you to come be chair of their board, right? And so I just want to challenge us all to consider that organizing is a long-term investment. And so that's something that I basically like get on my knees and beg my students virtually to take care of themselves in that process, because we get so emotionally invested in community organizing. We want it to all work right just now. That's our sort of microwave instant culture that we have, but it takes a long time to build coalitions and to do good work. The second thing is, you know, go looking for organizations that are led by BIPOC folks, again, Black, Indigenous, people of color. Look for those organizations because they're so rarely supported, and oftentimes there's sort of larger, more national nonprofits that are almost entirely white-led that are oftentimes dictating the terms locally. I also am a big fan of local organizing, so finding things in your community to get involved in, I think is a really important aspect of getting started on the community organizing piece. Hopefully that answered your question, but I'm happy to provide any follow-up to that.
Great, we have lots more questions coming in. So what policies do you specifically support that would increase opportunities for BIPOC? And this question asker says that nothing really seems like it's quite enough.
You know, the reason why I have become convinced more recently that this work really situates itself starting with us, you know, for BIPOC folks, a lot of it has to do with healing and doing what we call sometimes decentering the white gaze, which means finding out what it's like to be not defined by white supremacy and racism, but to discover, you know, many of us were raised in this sort of curriculum that was ahistorical and repeated many of the white supremacist tropes that we see today. So then we have to build new knowledge and information for ourselves. I say that to say this. I don't know that there's anything such as a perfect policy out there right now. And when we construct the sort of perfect anti-racist organization, I'll let you know. But that is something that I think you should all consider starting locally in your own organizations. You can say things like, hey, look, let's put together an anti-racism task force and start the process of figuring out what that's going to look like. I know people are like, you know, just absolutely tired of task force, and I get it. I lead like 5 at Boston College, but the reality is until we get into the room and talk to each other, we're not going to be able to start figuring out what these solutions look like for sure. Because I can tell you, you know, secure the pipeline to make sure that we have enough, applicants for employment. I can tell you that we should be looking even beyond the pipeline back into high school and undergrad. Are we preparing people so that they come into the pipeline prepared to go to medical school or prepared to go to public health school? But I'm also sort of reticent of that way of thinking if we're not going to also talk about what it looks like to explore a new way of thinking around things like our methods of inquiry and knowledge. Are we asking BIPOC folks to show up to school to assimilate into a white culture or white supremacist profession? Or are we really questioning the foundation of all of that altogether? Which is why I think it's really important for us to have conversations, because we are not anywhere near that kind of discussion yet, but we should be. And I think many of you in this room can help us get there.
A lot of us participate in institutions that perpetuate systemic racism, like academia, medicine, philanthropy. How do we garner institutional change in the face of systemic stagnation?
That's a great question. So the first answer is to understand your organization and your profession in detail. Understand what motivates your profession, your organization. I can't promise that knowing those things will lead to change necessarily, but it's almost like the case of using jujitsu, right? Like you're a much smaller entity coming into a much larger organization, and the way to bend that organization is to understand what is its final aims. Right? If we can create a process maybe of innovation that gets us the kind of product that we want to get and meets the sort of, the hospital's final aims. It enhances the brand of the organization that we're working with. Many organizations will say, fine, let's do it. Let's explore it. Not all will. So there are actually levels of organizations that are prepared for, sort of from like one kind of like all white kind of like boys club that's not prepared to do any of this work to the truly anti-racist organization. I keep saying that we still don't know. There's not sort of like a standard model of that anti-racist organization altogether. So we've got to really figure out what that looks like. And so the very first thing is when you walk into an org is to try to figure out where they are in their change process. A lot of folks are motivated to change right now. So this is a really great time to start exploring. I would say the big piece is if you're going to organize at work, understanding, who the key players are, the aims of the organization, and building a cohort of folks around you who are interested in doing that work are going to be key. I would not recommend doing it alone.
This is a question about sort of your personal feelings on this topic and whether or not, I think when this talk was first released, it was about policy change, and this particular participant felt like you talked a lot about individual change. Do you think that is something that has changed in your heart in the last 6 weeks, or was that unintentional?
That is like brand new Sam, like absolutely brand new Sam. So I studied policy in social work school, focused on policy while I was getting my doctorate, and that is just sort of the way that I think. I did, obviously a lot of political organizing. Policy is like something I love, and I think it's still very important to me. I'm becoming convinced that we can't intellectualize our way out of racism. I am becoming more convinced that it has a lot to do with the way that we approach kindness and listening and empathy and disrupting things like dominance. And so it's really key to me. So I say that to you. I'm like two different people at the same time, because I'm currently actually building a new class at the School of Social Work to focus on the history of social policy in the Black community in America. And so I do think like having a historical lens, understanding your history informs an understanding of how racism works in this country and throughout the world. And there's so much that we don't know regarding it. And yet at the same time, if we're not open to things like apologizing when we make a mistake, how do we intend to work with people who are different from us? And so I've become deeply convinced that a lot of this work it's a parallel process. Please, like, vote. Please follow what's happening in terms of policy. And please start the process of acknowledging how that shit shows up in your own life, in your everyday world.
All right, I think we're running up on time, but let's have one more question. I'm sorry if we didn't get to yours. This person would like to know how to confront people who perpetuate racism when they are the people in control. They say they're a medical student who sometimes hears comments from physicians' residents that are inappropriate.
Absolutely. Again, this is not the time to go it alone. So see if you can find a way to secure those key allies who are out there. Maybe this is an opportunity for you to visit one of the medical student associations and to talk with them about your experiences and some of the things that you've heard. Those folks may be actually able to then source either other physician colleagues or faculty members who are just as interested in doing this work. And then gathering those folks together to figure out an actual strategy instead of making it kind of like this, like knee jerk, like this is how I'm feeling kind of like moment. You can start looking at, instead of one person, you can start looking at, the entire organization. How do we as a group who are required to do this work in order to finish our education, how can we then work together strategically? So one of the things about organizing that we have to be, one of my favorite stories, I think, is probably Brian Stevenson. He came to BC last year in the time when it was like perfectly acceptable for us to crowd into auditoriums, basically sitting on each other's laps to listen to him. And one of the stories he tells about, how he came to Montgomery, he finally got his first chance to meet Rosa Parks. And it was another organizer who had invited him to come to her house. And so he showed up at her house, and the organizer looks at him and says, "Do you know what you're gonna say here tonight?" And he goes, "No." She goes, "Exactly, so don't say anything." She says, "Sit in the corner and listen until you've been spoken to." And he talks about that as a really important part of, coming to an opportunity to get involved in organizing. He went in there and he listened to Rosa Parks tell him about her life. And like, who wouldn't want that, one? But two, this is another way of saying that there's a vast group of organizing elders who have been out there doing the work for decades. Let's listen to them, so by tapping into communities who have been doing the work, community of colors, who have been working to create a protective factor oftentimes around themselves so that they can survive things like medical school and social work school and public health school, we give ourselves an opportunity to really benefit from the knowledge that they carry with them.
Okay, so in this next part, we just want a couple of people to sort of share something that was discussed in your group, or maybe some great insight that you thought of yourself during Dr. Bradley's talk. These are always the most painful sort of drawing out volunteers. So I would really, really appreciate some people being brave and stepping up. I think Lachlan is talking, but he needs to unmute himself.
I say two things. First, I just have so enjoyed connecting with Sam and learning together with him. But two quick things. I've reconnected with, of all things, a religion professor from college 100 years ago named Jeffrey Stout, who co-taught a lot of things with Cornell West, who decided he needed to study how movements really happen. And he spent a bunch of time going across the South, migrant workers, and he says, in every successful social movement in the last 100 years, the key people involved, it was all one-on-one relationships. Mm-hmm. And those grew into movements that actually had staying power. And tying that with Sam, I actually think the policy change and the individual emotional intelligence things end up being 100% interdependent, because every single time there's been a social movement for change, you hit hard times and it's incredibly frustrating, but it's the one-on-one bonds with people who are not going to let each other down. And the same thing if you're working, as Karen Wong was saying, I'm sure in a federal qualified health center, and it gets to be really tough. if you've made those personal bonds, you're going to get through it. And without those, so learning about other people, connecting with them, especially across white BIPOC kind of divisions, is not only the work needs to be done, it's actually the most meaningful, satisfying part. And then my soundbite ending will be, and that applies to all the Schweitzer Fellows for Life. This is one Zoom conversation, but I know Sam and others would love, if we have emails, whatever, stay connected. Maybe there's shared interests. Maybe 5 of us can talk about how does this apply to vaccine distrust is my current obsession with a bunch of people, but stay connected.
I think Rhonda Hodge also wanted to talk.
Oh, okay. Well, our group, we spoke about self-care, and one piece of information that Kimberly mentioned was that she was happy that people didn't just disappear after they saw the first page that had white supremacy on it, that people were willing to hang in here and to literally learn. And that kind of goes with my question that I had posed in the chat, is that what if someone, if you have an established relationship with a white person as a Black person, and if they sincerely ask, what can I do to help me understand? And I just wouldn't want to be in the position to push someone off, especially if you already have an established relationship with them, because I found that people are sincere in wanting to know. And we know who those people are. We know who they are. So I would just like to encourage us to, first of all, develop relationships with people before a crisis happens. Of course, we're living in a crisis now, but to have some genuine relationships with people so that when they come and ask, it's almost kind of like what Christ said, or what one of the disciples said, what can I do to be saved? So if someone says, what can I do to help enlighten me in terms of the plight of the African Americans or the Native Americans, that you're open-hearted enough that you're able to entertain their vulnerability and to help them. And because I do believe that that's how we're going to get through this in one-on-one relationships. And one of the other participants was talking about how she's, that her work, she's a doctor, and that her work is allowing her to literally be face-to-face with patients now. And I think all of us are craving this face-to-face interaction, because in my mind, that's a part of self-care too. Thank you.
Thanks, Rhonda.
All right, I think we might have time for one last comment. Otherwise, we'll wrap it up with some announcements. Rhea, take it away.
Okay, thank you so much everyone for being here. I think this was probably just one of the best webinars, especially so well timed and placed for the current age. You know, some amazing takeaways, some amazing things that we can really start to apply in our daily lives just came from everybody today. Relationships, kindness, empathy, listening, you know, ultimately just building that one-on-one. And I really think ultimately that's our takeaway, is realizing that spending the time understanding and learning and building those relationships together one-on-one, rather than just trying to surface level hit everybody, is really what's going to make the change. So again, we want to thank you for being here, for taking time out of your evening. Please save the date for the next webinar. It will be December 2nd. If there are webinar topics that you are highly interested in us hosting, you can always email us, let us know what you think would be really great, maybe a speaker you would absolutely love to see us have. Do not hesitate to reach out and let us do this. If you feel like you're extremely versed in a topic that you really want to bring to the table, then please let us know if you'd like to be a speaker as well. I know we have an incredible community on here of people that we can learn from. In the same note, if you're interested in being part of the webinar committee, please email us that as well. We have so much growth happening, so many different projections we're taking our future to, so we could absolutely use your skills and your time. Now, in order to wrap up, we do have an announcement by the Alabama Chapter Program Director, Kristen Boggs. So Kristen, if you would like to speak, please go ahead.
Sure, thank you, and good to see everyone tonight. So as our network of Schweitzer Fellowship chapters start to undertake asking these questions and trying to make action towards this advancing this racial equity work, we've realized that we also just are asking more questions about the values that underlie all of our work. ASF does not have a value statement, or at least not one that we can put our hands on or that we feel like would be an accurate representation of our organizational values at this time. And so we're inviting you to be a part of this process. We're going to be conducting a survey that's open to all current fellows, fellows for life, mentors with academic insight mentors, as well as members of the different leadership groups. It'd be a simple survey, and it's meant to capture what, from your perspective, are the organizational values of the Schweitzer Fellowship. And then we'll use that information and do some focus groups to try to work through some of the complexities that we know are inevitably going to come out from that. And then lastly, we're going to look at value statements from some of our peer organizations and try to take the survey and focus group information and write one of our own. So in summary, we just wanted to let you know about this survey that will be coming out and to encourage you to participate and to share it with other people that you know in the Schweitzer network. The survey will have a question where you can indicate if you'd be willing to participate in a focus group as well. And then we'll just look forward to reporting back to everyone about the final result in a few months.
Thank you so much, Kristen. And again, everybody, thank you so much for spending your evening with us. We wish you all the best. Thank you so much, Dr. Bradley, for speaking, and for the amazing webinar committee who has put in many hours to put this together to bring you the best we possibly can. So have a great night, everybody.